Well, good morning and welcome to South Australia's daily COVID update. I will start the press conference by indicating that South Australia will not be going into a lockdown. I'm joined at this press conference today by Professor Nicola Spurrier, the Chief Public Health Officer, the Honourable Stephen Wade, the Minister for Health and Wellbeing, Police Commissioner Grant Stevens, who is also the State Coordinator during this major emergency declaration. As I said, South Australia is not going into a lockdown, and I think many people will be extraordinarily relieved about that. But today we do announce 5 cases of COVID-19 in South Australia. We're categorising these as linked transmissions from the Northern Territory mine exposure site. After testing negative on day 1 and remaining at home since Saturday, a miner who worked at the mine and returned to South Australia has returned a positive test yesterday. His wife and 3 of his 4 children, all of whom have also been at home since Saturday, have also tested positive. We have now transferred that entire family unit to the Tom's Court Hotel, our dedicated quarantine hotel for those people who are COVID positive. They are now in that facility. While this is a very concerning turn of events and having this Delta variant in South Australia, we are very relieved that this person and this family have been at home since Saturday, very significantly reducing the risk to our state. We know that we have 28 miners who have returned from the mine in the Northern Territory, and we also thank them for remaining isolated during this time. It's yet another, I think, excellent example of the people in South Australia doing the right thing, educating themselves about this disease and making sure that they're taking the appropriate action to keep our state safe and ultimately our economy strong. Now, we do know that this Delta variant is particularly worrying. We see further deterioration of the situation around the country again today. So we must all remain extraordinarily vigilant. The Directions Committee has met this morning and they have decided to put some additional restrictions and recommendations in place so that we can make sure that we stay ahead of this variant. The direction that will be coming out later today will be reducing home gatherings to 10. So for the foreseeable future, we're going to reduce that down to 10 people. We also give some strong recommendations. The first of those is that if you are out in public, then we are recommending that you wear a mask. We think that this will help to keep us protected. So if you're out in a shopping centre where it's very difficult for the contact tracers to know who you've been adjacent to, then we're asking you to wear a mask. It's different if you are at a function or if you're in your workplace because you generally know who you're working with and we can get those people into isolation should there be a situation. But when you're out in public, when you don't know who you're standing alongside, we are asking you at the moment to wear a mask. Secondly, in terms of work, we're asking people to consider if they can't socially distance while they're at work and there is an ability to work from home, this might be something that people consider at the moment. Of course, this doesn't apply to essential workers and it probably won't apply to every workplace in South Australia. What we're saying though is if you can't socially distance at work for the foreseeable future, and we're not talking about a long period of time, but we are asking people to consider whether it might be more appropriate to work from home. We do need to be cautious in South Australia. We can see the consequences of getting this wrong. At the moment in Australia, we have a lockdown in New South Wales, Queensland, Northern Territory, and in Western Australia. We don't want a lockdown in South Australia. And again, I thank the people of South Australia for doing everything that they possibly can to keep our state safe and our economy strong. And again, I give my strong recommendation to the people of South Australia. If you develop any symptoms whatsoever, go and get yourself tested. And we have excellent testing results again from yesterday. So thank you very much. The second thing is when you become eligible to have your vaccination, please go and make sure you have that vaccination. And thirdly, we're asking people again, especially at this time, to be very vigilant with the use of QR codes because this is the first line of defence for our communicable diseases control branch, the people that need to do that contact tracing, often in the middle of the night, but they can access that data. They can access that data and start putting people into quarantine as quickly as possible. Time is of the essence with this disease, especially with the Delta variant, and so we're asking people to use the QR readers.
Do we know that the miner and his family were all isolating from the time they were all potentially contagious?
So we know that they originally returned, or that the miner returned on Saturday. He had his test. He was then isolating at home. The order came into place, South Australian order, to remain at home and in quarantine came through on the Sunday. But he was doing that in advance of that because of issues that were already in the media regarding the mine.
So neither he nor his family were in the community
No.
while they were contagious?
No.
Does that give you great confidence that you might be able to contain this?
Look, I think that we are very fortunate that this family has been doing the right thing, that all of the miners that have returned from the Northern Territory have been doing the right thing by isolating, making sure that they've got themselves tested. We haven't had any other positive tests from the other 28 miners, but of course, SA Health now are very concerned about this situation, and so they'll go back and retest those people and make sure that we're doing everything we can to keep isolated. It's a perfect example of why following the direction from SA Health keeps our state safe. If this family had completely ignored it, gone to the football, gone down to the local shops, it's quite possible we'd have a catastrophic situation on our hands at the moment. They didn't. They did the right thing. We're very grateful.
How concerned are you that there might be other miners that have tested negative in the first instance and are harbouring this virus in South Australia?
Well, look, it's a definite risk, and that's one of the reasons why we've put these people into home quarantine. That's one of the reasons why they don't come out of home quarantine until all of that testing shows that negative result, because we know that the incubation period can be up to 14 days. I'm often stopped in the street. Why don't you just test people when they come in, and if they return a negative test, we'll just let them go free? Well, this is a perfect example of why we do what we do in South Australia, because on Saturday, the miner returned a negative test and then developed symptoms, had themselves tested again yesterday, positive case. And this is why we've got to follow the directions, the excellent directions that SA Health have put in place.
What happens to people who were on the same flight as him? Was he potentially contagious on that flight?
It's a low risk, but again, this is now what SA Health is doing, and Professor Sperry can answer this in more detail, but now we look at everybody that was possibly coming into contact with this person, even though it's a low risk, putting them into quarantine, making sure that they're testing as well. And this is why we put these additional restrictions in place, home gatherings down to 10. We've already seen quite a significant reduction in movement across South Australia since media speculation this morning. We've seen the roads almost cleared in Adelaide. People in South Australia want to do the right thing. They want to be cautious. They don't want to go into lockdown, and we're very grateful for that.
I believe Alice Springs is going for 3-day lockdown because he travelled through there. How hard, given he's just travelled through there, he's in South Australia, how hard was it not to go into lockdown today and make that decision?
Well, of course, if we had information that this person had been out and about in the broader community and visited and created, dozens and dozens of additional exposure sites, I don't think there would have been any other choice, because we just know how transmissible this disease is. But in this case, there's still a risk, but in this case, we are satisfied that this is the appropriate response for today, Chris.
Premier, yeah, good to see you. It's a pity we couldn't catch up for an interview in the fortnight I'm broadcasting from here. But I wonder what your message is to South Australian casual workers who've missed out on pay and shifts, South Australia's small businesses who are missing out on turnover, from you imposing new restrictions this week based on 0 cases.
Well, I don't know whether you've been listening, but it isn't 0 cases. We've got new cases that we're reporting today, and one of the things that we've got to do. No, I'll just.
Because I said you brought these measures in, these restrictions in, based on 0 cases, and you effectively still have 0 community transmission cases because those ones you've announced today, those 5 people, were already in isolation.
Well, as I said, we did have cases when we put the new restrictions into place, and as we messaged at the press conferences earlier, you can't tell. Because of the incubation period, you can't tell. So you've got to be in front of it. If you wait till you find a positive case, it can be too late. And we've seen this repeated around the country, around the world. you have a massive wave and then you go into lockdown. And South Australia's done extraordinarily well. We still have the lowest level restrictions in the entire country. We have more people employed in South Australia now than prior to COVID, and that's because we have stayed in front of this disease.
But Premier, the last time you went into lockdown, there were no cases of transmission outside those who were already isolated, already identified. So the lockdown was superfluous. You even admitted that with the whole pizza box shambles and shortened the lockdown. We know that both of the Perth lockdowns so far this year, likewise, the lockdown was superfluous. The data shows the same for the Valentine's weekend lockdown in Melbourne and one of the lockdowns in Brisbane. And yet now you're telling South Australians they should be grateful, relieved you're not going into lockdown now with zero community transmission in this state.
I think I've answered that question.
Can I add even the hint of a lockdown? South Australians have started panic buying and clearing shelves. What's your message to them?
Look, obviously people are concerned with the media speculation this morning, but there is no lockdown. Can I just say in South Australia we've got excellent supplies of all food and other appropriate groceries that need to be procured if there is a situation in South Australia. There has never been a need for panic buying in South Australia, but look, quite frankly, it's probably a natural human behaviour. But again, I just say to people, please be sensible about this. No lockdown in South Australia, no need whatsoever for panic buying.
What does this mean for Adelaide Oval? What does this mean for
Just
Adelaide?
clarify, you said this miner returned on the Saturday, and it sounds like he voluntarily isolated with his family before the order came in.
Yes.
Do we know definitely that all the other miners and their families isolated immediately on their return and stayed in isolation?
Yeah, well, that's my understanding, but I might ask Professor Spurrier to answer that. Are there any other questions
Yes,
for me,
I
though,
have one
Stacey?
about a family that was allowed to fly in from Singapore
Yes.
after already testing positive for COVID. We understand that they're politically linked. Did you know about this family being given approval, and did you have any part in that approval process?
No, but Professor Spurrier has the details of that. She's happy to provide that.
Tony,
Just in
you say
regard
South
to,
Australians should be
this
relieved.
family being in isolation, we're hearing that there have been some exposure sites. Some businesses have said that they've received notice in regard to a potential case being there. So have they or have they not been in isolation? Is there the potential that there are some businesses out there that could have been at risk?
So, as I was saying, when they arrived, they went and had themselves tested. So I suppose one of the areas that we're concerned about, the person that actually took the swab, obviously going through the airport, there may have been some other minor issues, but what I can say is that actually the person wasn't directed in South Australia to go into isolation until the Sunday night. So there's been no breach there whatsoever.
Not breach, but is there a gap in their quarantine which could have potentially put South Australians at risk?
Well, all of those have been identified, and that's what we're working through at the moment. And again, Professor Spurrier can go through that.
So there are
Chris.
some
Just a couple of key
Sorry.
points.
So there
Well,
are some exposure sites.
I'll ask Professor Spurrier to go through that. I don't have the full detail for you.
Premier, you mentioned that South Australians would be relieved they're not going into lockdown
Yes.
today. What is the threshold that you and your team have set for lockdown? Are you suggesting that if there is any community transmission of the virus now, the whole state or the whole city would go into
No,
lockdown?
I mean, we go through this in all of our press conferences, but we can go through it again for you. But it really does depend on the individual situation. So if you have one person, you've got them very early, it's quite possible that there's no need for any further restrictions to be put in place. If you've got one person who has been to 25 sites, 35, 55 sites while they've been infectious, well, it's a completely different situation.
Yeah, but
So
what is the
I know
threshold for lockdown?
I know that, well, as I'm saying, we just consider these things on an individual basis based upon the risk and the information that we have at the time. What we know about the Delta variant is that it can move extraordinarily quickly. We know that the transmissibility of this variant is extraordinarily high.
We also
and so
know that its health impact is lower even than the first coronavirus 19 infections. So I'm just wondering, based on that, whether you ought to be, and other leaders around the country ought to be more upfront about the health impact of infections. For instance, you mentioned 5 infections today. Are any of those people showing symptoms, suffering illness, requiring medical attention?
Well, as I said, some of them have already developed symptoms. But look, 10,000 people are losing their lives around the world every single day. We're not taking chances in South Australia. We've done well in South Australia because we've worked in partnership with the people of our state who don't want lockdowns. They don't want unnecessary deaths in South Australia. We've listened to the experts. We've listened to science. We've listened to the evidence. We've taken action, and that's served South Australia well. I'm now going to hand over to
Just
Professor.
Before you go, I'll
Yes.
ask Professor Stewart,
Yes.
but just on the family that was given approval, if they're politically linked, did you know about it
No.
before they were given approval? You
No.
had no input.
I don't have any information that they are politically linked. So
Gladys Berejiklian has said that we can't put heavy restrictions and lockdowns behind us until 80% of the population is vaccinated. Now, no country has reached 80% yet, even on first jabs. What is the threshold that you would set before you can end this series of continual threats of lockdowns and burdensome restrictions?
well, that's an issue which we're considering at National Cabinet, and of course we always seek the expert advice. We're currently seeking the expert advice on a range of matters from the AHPPC. We also take advice from the TGA, ATAGI, as we take them from economic agencies as well. The National Cabinet is the best level of government, I think, to be making those types of
Premier,
decisions.
just in regard to the
Yes.
restrictions, you mentioned that home gatherings will be reduced to
10
people. What about events? Obviously, last night we were at Van Gogh Live. There's events happening in Adelaide. We've got Illuminate Festival starting next week. What is happening?
So
is
we've
there
already
reduced capacity?
Yes, so we've already announced that we've reduced the capacity to 1 per 2 square metres. On those organisations which have a COVID management plan in place, so that's more than 1,000, well, of course, we're going to be needing to work with them. So there may be some further changes, and that would be dealt with on a case-by-case basis. All of those COVID management plans
And
are.
how will it impact the footy on the weekend?
Well, we're yet to determine that, but obviously they do have that COVID management plan to manage football at the Adelaide Oval. We need to look at that risk, and if we need to take further steps, and that's precisely what we'll
And just
do.
in regard
Is
to
it
the
possible
recommendation to wear masks, why not just make it mandatory at shopping centres? Obviously, we saw yesterday it was recommended on public transport and hardly anyone had them on.
Yeah, well, look, that's the decision that we've made at this point. It's quite possible that things could move in another direction if there is a further deterioration in the situation that we have.
Premier, would you like to offer the people of South Australia and more broadly around the country watching premiers day in and day out at the moment, would you like to offer them some reassurance and share with them the facts about the very low number of people who are developing severe illness from coronavirus in this country and going to critical care beds, the enormous amount of health capacity we have, and critically the fact that all those who are vulnerable, the elderly, have had the opportunity to be vaccinated, at least one jab. So we're in a very, very good place in this country, and we shouldn't be rushing to lock down.
Yeah, look, the reality is we are in a very enviable position here in South Australia, more broadly around Australia, but we can't be complacent with this disease. We see the consequences of other jurisdictions who are really experiencing terrible catastrophic situations around the world. We do have a good health system in Australia. We've got a good vaccination program which is running out. We've got good QR codes around the country, and of course we have a population which is getting itself tested on a very regular basis. So we're in a good position, but we should never take that for granted. And I'm now going to hand over to Professor Nichols.
Just one more.
Yes.
On vaccinations, should people under 40 get AstraZeneca or not, as far as you're concerned?
Well, that's a decision for the individual. I suppose what they now have is that alternative. Previously, they weren't given that alternative. The ATAGI recommendation is really AstraZeneca for 60 and above, but some people may form the opinion after consulting their doctor and having that informed consent that they would rather take the very small risk of developing TTS, but would rather have that very small risk compared to the risk associated with a further escalation of this disease. That's an individual decision, and people will need to make up their own mind on that after they've sought advice from their GP. Okay.
Thank you and good morning. And I'd just like to say that I'm here to provide details to the South Australian public about the cases and about the risk that this poses to our state. And I know that you'll want to ask me some questions, but I would just like to have the opportunity to provide that detail first. But I would like to say that this is a very severe disease. We have had people very sick in our intensive care unit recently with COVID-19, and those have included very young people. So this is a serious problem. We've also had extensive modelling from the AHPPC about the Delta variant, and that if it gets into your community, it is very difficult to control, even with the sorts of lockdowns that we are seeing around the country. So we actually have 11 cases in South Australia today, but 6 of these are overseas acquired. 2 are old cases and previously counted, and they are all in the Medi Hotel. But let's focus on these 5 additional cases. We have the man who's in his 30s, who's the known close contact from the Northern Territory Tanami mine case. In addition, his wife is now positive. She's in her 30s, and there are 3 children under the age of 10. There's also a little bub who is not yet positive. What we're seeing with this Delta variant is that there's almost 100% hit rate in infections to those close contacts, except if people have been vaccinated. This family, as the Premier said, have been transferred to Tom's Court this morning. Now, I'll just want to give you the time frame and the reasons why we have some ongoing concerns and the reasons why we have put some further restrictions in place today, and why our team has been increased in size today, and we have certainly a lot of work to do, and we've been working overnight to help contain this issue. So the miner travelled on a charter flight into Alice Springs on the 25th, which is Friday the 25th. He was in Alice Springs for about 6 hours in the Alice Springs airport, and our information is that he wore a mask, but obviously when you're there for 6 hours you're going to have to take your mask off for eating and drinking. He then boarded a Virgin flight, and that was on Friday the 25th, and it's VA 1742, and it arrived into Adelaide at 5 p.m. on Friday night. Now, this gentleman did what you do when you're on air flights now in Australia, and wore his mask. He only had hand luggage, and so he came out of the flight through the airport and quickly moved through the airport, and his wife picked him up. As I understand it, they swapped over the driving, and he proceeded to drive home. Now, on the way, he did stop to get some takeaway food, and then he went home. We have been involved in South Australia at helping to coordinate, along with the Commonwealth, the follow-up of over 900 miners, so a very big exercise. But the mine themselves, and I was very lucky to actually visit Olympic Dam last week, the mine themselves, and this is obviously not Olympic Dam, but this is Tanami mine, have a very good way of doing their contact tracing, and they had already texted all of the miners that had left the site that were at risk. And so this gentleman received this information, and that was why he got a test that morning. And we had a result back at 11 o'clock that it was indeed negative. He proceeded to go home, and he has quarantined, as I said, with his family during that time. Now, there are some little complications here. So one of the things was he had some mild symptoms on Saturday, but many of us have mild symptoms at the moment, right, of colds, but he tested negative. He then developed a headache and some aching muscles on Monday, and because of that he went and got retested on Tuesday, and unfortunately his wife also developed headaches and got tested on Tuesday, which was yesterday, and both of those tests have come back positive. We've subsequently had our domiciliary testing go to their house and get tests late last night. This poor family, it's pretty disruptive, but unfortunately we have got those results back that 2 of the young ones are positive, one's presumptive, so in the start of the infection, and the little bub fortunately at the moment is negative. And as the Premier said, they have been transferred to Tom's Court. Now, in our experience working across the last 12 to 18 months with COVID, we have occasionally had a false negative result. And the reason for that is not because of our laboratory, but sometimes if you've gone and had a COVID test, sometimes you'll find it's quite painful, but occasionally you'll get one that's just not as painful and you'll think, gee, that was pretty easy. And occasionally the collection is not deep enough. Now, because I am going to take an absolute abundance of caution, because I do not want this Delta wave in our community for obvious reasons, we are going to be considering that could possibly have been a false negative test on Saturday. And because of that, we have determined that everybody that was on that flight will be going into quarantine. And we've SMS'd using the manifest this morning, and we've been able to contact 108 people, and we're asking them to get tested, and we're asking them to quarantine. Now, there's a small number. When you get manifest, not all the mobile phones are correct, and there's a small number of people that we haven't been able to pick up yet. And so I'm asking you, if you have been on that flight, and I'm very grateful to journalists here to make sure you get this message out. If you have been on that flight on that Friday, it's very important that you get tested and you go in quarantine until you hear from SA Health. The other potential exposure site, even though he was wearing a mask, is the airport. So again, we have good contacts at the airport, we have CCTV footage, and what we will be doing is looking at that potential pathway today to see if there's anybody else that we need to have tested and indeed quarantined. Our team have already contacted the takeaway food area and shop, and so again, we're doing the contact tracing in an abundance of caution in the face of possibly a false negative test. And then the other, a couple of people that we have already had tests back this morning, I'm really pleased to be able to report this, is these kids' grandparents who had very, very brief contact with this family on Saturday. And those tests have come back negative this morning. I'm very, very pleased that we've got that result. There was a couple of other areas, and again, you can understand that we are thinking logically through any of these pressure points or potential exposure points. Those are when this family went and got tested. So that is a couple of our SA pathology staff and also one of our private pathology providers. And we also will require those people to be tested and have a quarantine period. And so, as you can see, even though these people absolutely did the right thing, they quarantined, my understanding is they had food dropped off and the like. We're just spreading the net a little bit more broadly because we do not want this Delta strain in South Australia. So in terms of our restrictions here, obviously because this is at the moment contained, and we're trying our very best over the next 24 hours to make sure it stays that way. We do not require a lockdown here in South Australia, but what we do need is people just to be really sensible at this point in time. We've also got as a potential risk the other minors, and my team will be chasing them up and making sure that we retest. Of course, when you're in quarantine, you do require tests at certain times. We just want to make sure we've touched bases with all of those people. This will be the reason why as well that there's potentially contact tracing happening in the Northern Territory around the time that Minor was at the Alice Springs Airport. So lots of work to do. And I'll pass over to the Police Commissioner, we have recommended that we change a little bit of our direction. We want to only have 10 people in the home. The private gatherings will stay at 150. Masks are a really simple way of protecting all of us protecting yourself and protecting other people. So we will be having a strong recommendation for wearing masks in indoor public spaces, and that's the sort of place where you're coming in contact with a whole lot of people you don't know and you can't stay away from each other. Also, the Delta variant is very transmissible, and you can just have this very fleeting contact. I'm not wearing a mask in here today. I happen to know everybody else who is in the room today, and if we needed to, we could do that contact tracing.
Professor, what was the takeaway store?
I don't have the details for that. If we feel that it's a public exposure site, that will go up on our website.
What suburb was it in?
I actually can't tell you that, I'm afraid, Andrea.
Do you know how many close contacts have been identified?
So I've got 108 that got the SMS from the air flight, and there's a very small handful other than that. And as I said, we're just looking at the CCTV footage in the airport.
Which testing clinic is a possible exposure site?
So it's the Victoria Park and the private pathology. I'm not sure of the actual location at the moment.
What does it mean for the football on the weekend? What does it mean for the Crows game?
So very good question. So we've been in contact with the Adelaide Oval and we're talking to them again this morning. As you can see, we're at the very beginning of this. So we're putting some protection in place while we're getting further information. The Adelaide Oval, we're going to open up their ticketing this morning, and we had come to an arrangement which I felt was quite safe yesterday. We'll have another conversation with them today about whether they would like to open the ticketing, knowing that we might need to pull it back down the track. I don't think there's a problem with the game being played. It's just whether we have spectators and in which way we have spectators.
What sort of measures are being taken at the family's home, and whose responsibility is it to carry that out?
At the family.
The family home that they were isolating in, what measures are being taken at that residence in terms of cleaning, and whose responsibility is that?
Yes, so that's probably not absolutely, a key risk for us at the moment, but we will be looking at having that house cleaned. Just to say, look, we always come across a few little hiccups. That family have a very nice dog. It's also pregnant at the moment, so I've got a team sorting out the dog. There's all sorts of things that we have to do in this pandemic, but from our perspective, the most important thing is having that family moved in a safe way, in daylight, into Tom's Court, and make sure that they're all fine. And if they do have any medical problems with this disease, and certainly the husband and wife are symptomatic, then we'll be dealing with those things. I do think it's possible, but in this instance, I'm not particularly worried about the dog, other than the fact that it's pregnant.
Professor, what should people do in the public? What's your message to them when it comes to mask wearing? In what situation should they wear a mask?
Yes, so particularly when we have this already in the direction, it's very important when you're in a place where there are other vulnerable people to be wearing a mask. And in our healthcare services and aged care services, we would much prefer a surgical mask, because it really is a better level of protection. And all of those sorts of facilities will have their own policy on that. Otherwise, cloth masks are fine. It's better for the environment because you can reuse them. So we are very, very keen on people having masks on in those public spaces where you can't keep a distance, and particularly where it's indoors. So that will include, if I was going shopping in Rundle Mall today, in the supermarket, for example, at a pharmacy store, those are the places where we'd like to see people wearing masks. In an office block, so when I go back to the Department of Health, I'm working with those people, and we know where everybody is. In fact, we have our own QR check-in, not only in our building, but on various floors. So we know where people are, and we're working with them on a regular basis.
Professor, I want to ask you a couple of questions about your strategy, but first up on this news today, isn't the public information about the name and location of that takeaway shop?
So we always put in our public exposure sites when there is a requirement to do so. So the most important thing first is for our contact tracers to get clear information about where that person was at the takeaway store. If they were just at the drive-in and all they have done is interacted with one person, then the most important thing is to have that person located, tested, and if they're negative, nothing more needs to be done. So there's no need to make the community panic because they happen to have been to a particular takeaway store if that's not necessary.
Professor, on your strategy, I just want a three-pronged question, if I may, and that is, it's very clear that you in South Australia and at least 4 other states are running a COVID elimination strategy, a COVID zero strategy. So on that, firstly, why aren't you more upfront about that, declaring that's what it is? Secondly, do you concede that in the medium term...
Why don't I think I might answer the questions as they come, because I've had very little sleep and I want to make sure I answer them correctly. So in terms of the first question, do we have an elimination strategy? It's very clear from our National Cabinet that we have a no community transmission strategy. We cannot eliminate the risk of COVID because it's elsewhere in the world. So we have to accept that we have a risk when we bring people into Australia from other countries. But we are having a no community transmission. This is exactly why we are doing what we're doing in South Australia today. We absolutely know, looking at other countries, that if you do not have a well-vaccinated community, and by well-vaccinated, it needs to be at least 80%, if not higher, particularly for these new variants, then you will, that the disease will run wild without some of those other public health interventions, such as restrictions.
Well, as you mentioned there, you won't tolerate any coronavirus outside hotel quarantine. You and the Premier both said you don't want the Delta virus in Australia. In common language, that's an elimination strategy. Do you accept that it's unsustainable, that of course coronavirus will circulate among the Australian community at some stage? And it sounds obviously when we open international borders, we will see more COVID-19. However, what we need
to do as a South Australian community, and in fact not only an Australian community but internationally, is get as many people vaccinated as possible. If everybody in South Australia was vaccinated and you had poor vaccination rates in other states, we'd still be at a risk. And similarly, we also need to support other countries becoming fully vaccinated. As is evident, when you have disease that is out of control and it's continuing to replicate, you have variants of concern. And it's very clear that this Delta strain has a biological advantage, is passed on more easily to people, and is much more difficult to control with your standard public health measures.
Professor, can I ask you, on the Delta strain, the family that was given an exemption to fly into South Australia that were positive before they got here, did they have the Delta strain?
Look, I'm not absolutely sure, but we can get that information to you.
And can I ask you about the exemption process for them?
Yeah, sure.
Who was it that granted the exemption, and was any consideration given to the fact that they are politically linked?
I have no information at all about the politics or political linking. However, what happens is a standard procedure is we have Medivac retrievals when people are sick in our region, and those are places such as Indonesia or PNG or any of those sort of local areas. And it is a charter flight, it's a small flight, it's a retrieval, medical retrieval plane that goes and gets those people. It's also done as a hospital-to-hospital transfer. So the initial contact will be made between the hospital where that person is and in our state, the Royal Adelaide Hospital. This actually happens on a fairly regular basis in the eastern states, such as Queensland and New South Wales, because of course they're a little bit closer to many of those regions. But in this instance, this family live in Adelaide, and so they're a returning resident, and this is why this Medivac retrieval was organised in this way.